Hello everyone, and thanks for joining us. Welcome to today's luncheon event at the Rumi Forum in Washington, D.C. I'm Tariq Shafee. Our guest speaker today is Dr. Mark Nord, and the title of his talk is Struggling to Feed the Family, Household Food Security in Recessionary Times. Dr. Mark Nord is a sociologist at the Economic Research Service of the U.S. Department of Agriculture. He leads the agency's work on measuring and monitoring household food security and conducts research on measurement and determinants of food security. His previous work includes research on natural resources, rural poverty and migration at ERS and at the Pennsylvania State University, management of relief and development programs of a non-governmental organization in Bangladesh, and bush flying in the jungles of Borneo. He received MS and PhD degrees in rural sociology from Penn State University. Dr. Nord, welcome to the Rumi Forum.
Thank you.
I wonder if you would start by giving us definitions of food security and food insecurity, and give us a sense of how these terms relate to us today as Americans.
Okay, that's a good starting point. I probably need to start by saying what aspects of food security I won't be talking about, because the phrase is used actually with several different meanings. We'll be talking today about food security in the sense of whether households can afford enough food. And the agency that I'm with, which is the Economic Research Service of USDA, looks at household food security and studies household food security both at global level, particularly focusing on low-income countries, and domestically in the United States. And today I'll be talking about my part of the work, which is domestic food security in the United States, whether U.S. households can afford enough food and how many of them are having difficulty affording enough food. I brought along copies of a number of reports which are out on the desk, and one of those is the global, even though it's not my area of work, I brought along several copies of the Global Food Security Report for those that may be interested in that side of the work. But today we'll be talking about domestic food security, and as the kind of the conceptual level, what we mean by food security is consistent access to adequate food for active, healthy living. So it doesn't mean you can always afford to eat exactly what you want, but it's adequate for active, healthy living. That's the concept that we designed a measure to try to get at in the United States. Mm-hmm. I might start just with a question. This is work done by the United States Department of Agriculture, and I think an appropriate question is, why is USDA interested in this? What's our stake? What's the USDA's stake in this? And I just throw out a question that if you haven't had a preview peek at the food assistance landscape, if you think of USDA, so we've got the farm subsidy programs, the commodity programs, the rural development programs, the forestry programs, U.S. Forest Service is part of USDA, the Ag Research Service, which does this, and then the food assistance programs. So who wants to venture a guess, or maybe you know, what the role, what's the say percent of the budget, of USDA's budget that's in the food assistance programs? Anyone have an idea? 20. Okay, I've got 20. Do I hear more? Most people are surprised to find out almost 2/3 of USDA's budget is in food assistance programs. So SNAP, the new name for the food stamps program, the school lunch and school breakfast programs, WIC, those are the three big ones, and then a number of smaller programs. So together, USDA's investment in those programs is twice the size of the rest of their combined budget for all of those other things I mentioned, which is why USDA cares about and needs to know about how many households are having trouble putting enough food on the table. So I might begin with a little theoretical foray into measurement and the role of measurement in social policy. I'm going to start with another question. This is I'm warning you in advance now, this is a trick question. So in the 1930s, then President Roosevelt said that he saw a third of the population ill-housed, ill-clothed, and ill-fed, which implies there was a poverty rate of 33%. So what really was the poverty rate in the mid-1930s? It's a trick question, so you can give me an essay. You don't have to give a short answer. Well, the sociologically correct answer is there was no poverty rate in the mid-1930s because poverty was not measured until the mid-1960s. Now, the objective conditions that we think of as poverty probably existed, but poverty is a social creation, and it was created by measurement. It was created during the Kennedy administration when there was an interest on the part of some of the policymakers, including the president and his brother at that time, to do something about it. And one of the ways you get motivation to do something about it in the public and political sphere is to measure the thing that you care about. And so they started measuring poverty. It's actually a measure of income compared to a poverty line. So that was in the 1960s. And before that, poverty didn't exist. Poverty is a social construct, and it's constructed by creating a measure. The history of the food security measurement project has kind of similarly interesting roots. Following the significant investments in the 1970s and the beginning of measuring poverty, poverty rate went way down during the 70s, and there was a perception that problems of hunger had been overcome in the country, that hardly existed anymore. And this very well may have been true. Poverty levels were lower then than they have been ever since then. But in the 1980s, there began to become kind of stories, anecdotal stories of a resurgence of hunger in the country, particularly in the lower Mississippi Delta, in the Deep South, in Appalachia, and in the large cities. And there were a couple of prominent reports. One was called the Physicians Task Force Report on Hunger. It was in the mid-80s. And then the president's, that was then President Reagan, President's Task Force on Food Assistance. And both of these studies concluded that when you go out and look, you can find it, but we don't know how big it is. We don't know if it's a big problem or a small problem because we have no measure of it. So in 1990, Congress got involved. They passed an act called the National Nutrition Monitoring and Related Research Act. And I won't go through all of the outfall of this, but out of that grew a 10-year plan. Out of the 10-year plan grew the Food Security Measurement Project with a mandate to develop a measure of hunger or food insecurity that could be implemented at the national level and throughout the National Nutrition Monitoring System. So that was passed in 1990, followed USDA and the Department of Health and Human Services were the prime movers in it. And by 1995, they had laid the conceptual groundwork for it, developed a set of questions, and fielded it in a nationally representative survey, the Current Population Survey in 1995. From that, developed a scaled measure and began publishing reports. So another one of the reports out on the desk is Household Food Security in the United States 2008. It's our most recent report. And we've published reports on food security every year from 1995 to the present. A little bit later, you may be familiar with what happened in 2008, but I'll review those statistics a little bit later after covering some of this sociologically interesting, but maybe politically not very interesting conceptual matter. So, how does this work? How do we go about measuring food security if we're interested in knowing whether households can afford enough food? Well, there's a survey that's in the field every month. It's a current population survey. You'll be hearing results from December unemployment in just a few days. So it's the survey that the big national unemployment statistics come from. Once a year, after they're done asking all those questions, if you were in the survey, they would begin like this. I'm now going to read several reports that some households have given about their food situation. Please tell me whether this was often true, sometimes true, or never true for your household in the last 12 months. And the first statement is, we worried that our food would run out before we got money to buy more. So you'd answer that. And then they'd say, the food we bought didn't last and we didn't have money to get more. Was that often? Sometimes or never true. And the next one is, we couldn't afford to eat balanced meals. Now if you said never to all three of those, they won't ask you the rest of the questions because they already know you're food secure, and they're just going to skip the rest of them so they don't annoy you. If you said yes to one of those, they would follow up with, you'll notice these keep getting more severe. In the last 12 months, did you or other adults in the household cut the size of your meals or skip meals because there wasn't enough money for food? It goes on and begins at the more severe end, begins to ask whether you went whole days without eating because there wasn't enough money for food. And if there's children in the household, a similar set of questions about the children. Based on those questions, we classify households into basically three categories. Food secure, well, let's say two first of all. Food secure, food insecure. So our main statistics are on the proportion of households that are food insecure. And you might think of this as kind of the iceberg. And then the tip of the iceberg is what we now call very low food security. I'll talk a little more about this vanilla label later. This is households that, well, first of all, to be classified as food insecure, you have to say yes to at least three of those questions. So nobody's going to be listed as, in spite of what was written in a national newspaper in Washington after our last report, that some people are in this food insecure are just there because they worried that their food would run out. It's not true. You have to say yes to at least three of these questions. And then you have to say yes to 6 to be classified as having very low food security. That's a category we used to call food insecurity with hunger. And that gives you some idea of what's in that. Basically, those are households where people are cutting back on the amount they eat, not just the quality and variety of their diets, but cutting back on the amount they eat below the level they think they should. So I'm going to just run over quickly the statistics from the 2008 report. The Department of Agriculture gave a lot of attention to the report this year. Some years, you know, it kind of slips out and nobody pays any attention. Some years it seems to really matter. And this year, the Department of Agriculture gave a lot of attention to it, in part because the news was bad and they knew that it was going to be bad and wanted to make sure that people knew they were paying attention to it. And in part because child nutrition reauthorization is on the docket, legislative docket for the near future. And the current administration has made a pledge to end childhood hunger in the United States. So in 2008, 14.6% of households were food insecure. That was up from 11.1%. So it went from 11.1% in 2007 to 14.6% in 2008. In a sense, this was old news. We already had all kinds of economic indicators for 2008. This was, we're nearly, 9 months after the fact by the time the food security report comes out. We're not the most timely. So it wasn't news, but what it tells us is the extent to which economic bad news converts into real material hardship. And this is by far the biggest jump we've ever seen in a single year, and it's the highest that food insecurity has been since 1995 when we started measuring it. So 14.6%. The very low food security, this tip of the iceberg, went from 4.1% in 2007 to 5.7% in 2008. And the tip of the iceberg, households with very low food security among children, so children eating less than their caregivers think they should be eating. Most of these, the households report that children were hungry at times during the year. There wasn't enough money for food. That statistic was 1.3% of households with children in 2008, which may be big or small depending on what your expectation is, but it had been 0.8% in the previous year. So there's work to be done.
Dr. Nord, if I may just interrupt you.
Sure.
You mentioned, of course, high unemployment and the recessionary times we live in, but there are other reasons, aren't there? Are there not man-made disasters, naturally occurring events, land degradation, water shortages? Perhaps not so much in America, But globally, I would imagine those are events that contribute to food insecurity.
Yes,
Rule of law.
and some of those are long-term processes that have a cumulative effect over a number of years, and some are relatively short-term. The recession, if we just look at kind of recent years and look at unemployment, highest monthly unemployment in each year, it almost tracks exactly this uptick that we've seen in the last year in very low food security.
You would say 2009 in America is going to be worse than 2008? And 2010?
Based only on economic indicators, 2009 very well could be worse. There are some possible mitigating factors that we don't know about yet. The stimulus package included a substantial increase in the size of food stamp, now called SNAP, benefits, which not only help households that are on the program, but also motivate households that may need it to enter the program. So that could have a mitigating effect. But based only on the economic indicators, yes, we'd expect.
With all the
it to be worse in
resources
2009.
pumped into these programs, the trend lines are disturbing.
14.6% is that's a lot of households. If I called up my children and asked them these questions and they said yes to 3 of those questions, I'd be concerned. So yes, it is a severe condition, severe enough to be concerned about. There's a lot of research evidence that even those light levels of food insecurity in households have implications for children's health and development. There's a fairly large body of research now based on National Health and Nutrition Examination Survey. So there are implications. They're not just numbers on a page.
Sure.
So I want to go back a little bit now. I've used the word a few times, the word hunger, in connection with food security, and I want to try to clarify a little bit how those concepts relate, which turns out to be extremely difficult because different people mean different things by hunger. In the beginning of this project, back in the mid-90s, we wanted somehow to relate food insecurity and the way we were measuring it to hunger. And so they went to the Oxford English Dictionary and you pull out the definition, and hunger is the uneasy or painful sensation that results from not eating enough. So they said, well, now what are we going to do with that? Hunger can result from food insecurity if food insecurity is prolonged or severe, but it's not exactly food insecurity. But it turns out some people, when they say hunger, they really mean what we think of as food security. And some people, when they say hunger, they really mean something more like persistent clinical undernutrition, wasting and stunting. And so it's tricky to incorporate hunger language into the measure. Well, we tried, and the initial classification scheme, so the food insecure households, we classified as food insecure without hunger, food insecure with hunger. But there was a continuing dialogue in the both at USDA and between government departments about the use of that word hunger. Hunger is an extremely potent word politically, as you well know.
If you add chronic hunger, it becomes
even more.
I guess akin to famine, maybe.
Yeah. So what do you do in the government if you come up against a scientific question that involves public perceptions? Well, you throw it to the national academies. So USDA asked for guidance from the national academies, and they called a panel. If you're familiar with the way the national academies work, the panel members are from universities around the country. They're not paid for what they do. If there's anything in Washington that's kind of unpolitical, it's the national academies. So their Committee on National Statistics came back and said, yeah, it's probably better to think about hunger as an outcome and think about measuring it separately from food security and keep that language out of the measure of food security. So USDA did that. In 2006, we created this new labeling. Well, of course, it has almost no meaning. You have to give it meaning because nobody in the street talks about food security. So we have high, marginal, low, very low food security. That's the language we're stuck with, and ever since then we've been trying to give meaning to those categories by what's going on in those households along the lines that I've mentioned today. Of course, USDA took a big hit over this publicly when the 2006 report came out, because the perception was that the government was trying to hide the presence of hunger because we no longer used the word in connection with the report. The present administration is kind of straddling the fence on that. They're using the word hunger, I think appropriately, to talk about the condition in the abstract, but not necessarily tying the word to specific statistics that we generate. So that's kind of where we are on hunger right now. Meanwhile, nonprofit, through a collaboration with a nonprofit, we got a survey in the field to find out what the American people actually think the government should mean by hunger. And it's all over the place. But the median is pretty close to where we started, so we weren't too far off target. I'm just going to say a few words about USDA programs and then a little bit of an international focus. So the three largest programs, now called SNAP, which is Supplemental Nutrition Assistance Program, everybody still knows of it as food stamps, is now up to about 1 out of 8 people in the United States. The food stamp caseload is at an all-time high. There's 2009, fiscal year 2009, was expenses for the program were $79 billion by the Department of Agriculture. I'm sorry, that's for all programs, $53 billion for SNAP. And then school lunch program that touches almost every school in the country. Low-income students get free meals or reduced price meals, and higher income, children from higher income households nominally pay full cost, although theirs is also subsidized a little bit. And then there are community programs like food banks, food pantries, and so on that you're familiar with. And USDA actually provides some support to them as well, although a lot of their support comes from the community. Now, I've already mentioned that the global, I'm going to talk a little bit about the difference between kind of the global food security language as it's used in the global context and as we're using it domestically. USDA, our agency, ERS, as well as FAO, each have projects that estimate and project the extent of food insecurity, or sometimes they use the language hunger, in low-income countries. And in general, they mean a more severe condition than what we're measuring in the United States, that basically represents persistent inadequate intake of macronutrients, so undernutrition in calorie and protein. In addition to that kind of international side, there's another international side that's based on the domestic side. So this scale that we developed in the United States generated a lot of interest in other countries around the world, both high-income and low-income countries. And they kept coming to us, basically to me. I'm kind of the Food Security Measurement Project, have been for a number of years. I now have a couple of other team members, so things are looking up, for technical consultation. And I ended up working with a very interesting group of people from a number of different countries around the world, extending this measurement method, the household survey measurement method, into other countries. So there are now national surveys, government-sponsored national surveys in Brazil, Colombia, and Canada. And there have been kind of one-time national level surveys in a number of other countries, including Israel, Palestine, although it hasn't been published, Portugal also not published, and then dozens of pilot surveys around the world. One of the kind of things that has developed from this in my mind is the centrality of food security, and food security measurement in international and intercultural and interfaith dialogue, which kind of gets a little closer, I think, to what a lot of people in the Rumi Forum are interested in. Food is a shared common experience among all humans, and the giving and providing of food to guests is very important in many cultures. And almost everyone has experienced at least transient hunger at some time, most of us not persistent, and most of us not because we couldn't afford the food. but enough that we can at least imagine what it's like to have that feeling and not be able to do anything about it. So in a sense, issues of food and hunger come pretty close to a shared human condition that we can talk about and work at together. One of the most exciting things that I've been involved in, I think, in my entire career at USDA was a conference in Beersheba about 5 years ago. It was jointly sponsored by Tufts University, Ben Gurion University, and Al-Quds University. And it brought together researchers from Palestine, Israel, and the United States working on food security and nutrition, particularly nutrition interest issues in children. For some of the Palestinians, although they knew their Israeli colleagues and their American colleagues, they had not been able to travel to actually be in meetings with them for a number of years. And somehow, I don't know how this happened, I guess Tufts pulled some strings through embassies or something, but they all managed to get together. And it wasn't a spoken objective of the meetings, but there seemed to me to be a kind of a subtext of peacemaking through collaborative research. And it was a very exciting time, and I guess confirmed kind of my suspicions that food security work, food security measurement can be a uniting and peacemaking effort. So maybe with that I'll stop, and if you have questions, I'll see if I can answer them.
Well, all right. Globally speaking now, food has been used as a political weapon, has it not? Say countries of Africa, developing nations and underdeveloped nations, you know, the warlords, the dictators, they've been grabbing land, for example, for their own political use, buying votes. And so do you have any comments on that? Food has to be, it's abundant, but it has been used as a political weapon in a lot of these nations. Do you have any thoughts on that, how we can influence those types of food grabbing techniques that dictators use?
I have to be careful because although you should take anything I say as my views and not those of USDA, in a sense I'm here as a representative of USDA, and this is outside of my area of expertise. I have personal views, but they're no better than anybody else's personal views, and since they're not based on research that I do, I probably shouldn't talk about them.
No, I think you should.
But
Go ahead.
The issue you raise is certainly an important one, and I would, again, I think, suggest people who are interested in the global side take a copy of the Global Food Security Report from ERS. It's also available on the website. There's other materials there as well, and there are people at ERS who work on research that exactly would address those kind of questions, but it's outside of my area of expertise, and I probably shouldn't speak to them. I know a bit about causes of food insecurity in the United States, but it's outside of my professional scope, the global scene.
Fair enough. America does export a lot of food, but at the same time, people who are hungry, Appalachia you mentioned, and other, the Mississippi Delta, they probably are angry at the fact that they are going hungry while we are exporting so much overseas. That's a domestic issue, if you could care to talk about that.
Yeah, domestically, and actually this is also true mostly international. It's one of Amartya Sen's great contributions to the whole food and famine issue, is that for the most part, famine, even famine, has not been about inadequate production or availability of food, but about inadequate entitlement to food. And that's true in the United States as well. We certainly have very adequate ag production. And in fact, in the United States, households that are food insecure, it's rare for that to be a persistent chronic condition year after year. It tends to be cyclical even during a month or over a period of several months, so that average calorie intake among even food insecure households may be excessive. Overweight is a problem both in the food secure and the food insecure populations in the United States. So we're not talking in the United States about long-term insufficient calorie intake, but more in poor diet quality. So if you have more money to spend, you don't tend to eat more calories, you tend to eat better food. And so in a sense, the great challenge of food security in the United States is not getting enough calories, it's getting healthy diets. So the issues in the United States aren't ag production or even export-import. There's very adequate food supply in the country, but it's economic access to that food.
Some of the solutions to food insecurity then, engineered crops, something more technologically advanced way of manipulating grasslands, farms and so on. There's a huge farm lobby in this country. Does that impact food security in any way in America? The way we subsidize farmers?
This would again be outside of my area of expertise. It's almost certain that that any subsidy program distorts the market and has a distortionary effect on what types of crops are produced. But whether those are good distortions or bad distortions are outside of my area. But I guess returning to the U.S. Situation, the main issues are economic. If you look at how food insecurity relates to income, for example, you could almost say it's an income story. Households with adequate income. There's food price issues there too, but in general, households with adequate income, employment, and education tend to be very food secure. And as not surprisingly, those with incomes below the poverty line, even between, say, the poverty line and up to about twice the poverty line, have substantially higher levels of food security. There's also a non-economic side of this that has to do with household composition and support of extended family. Nothing buffers against hunger like good extended family.
Right.
So, for example, single mothers with children, particularly single parents with children in general, but especially single mothers with children in the country, have much higher levels of food insecurity than married couples with children.
Obesity has been a high priority of our dialogue, health issue, but undernourishment, famine, food insecurity don't seem to get as much attention. Would you agree?
That's true. The two may not be completely unrelated. The research evidence is a little mixed on how food security relates to overweight. I mean, a very naive approach would be, well, if they're food insecure, they shouldn't be overweight. But as we've already discussed, it doesn't often work that way, especially at kind of relatively lighter levels of food insecurity, where it's basically quality and variety that are suffering more than caloric intake. There's some evidence in some subpopulations that lighter level of food insecurity is associated with higher rates of obesity. But the research evidence is mixed. The problem in this whole area of research is that diets of Americans in general, whether they're rich or poor or food secure or insecure, are not very good. And so
that goes without saying.
So the problem is the problem of sorting out the effect of food insecurity is not so easy.
Oh, fair enough. Before we open the forum for a Q&A session, just on a lighter note, can you describe your passion for bush flying for us?
Well, I guess you could say that's an old passion. I worked that was my first or second career, depending on how you count it. But I worked in Indonesia and then in Central America, doing air ambulance and flying in. It was a church-related organization, so it was flying in support of both church efforts and local development and government services. Particularly in Indonesia at the time, in Borneo, where we were working, there was no other air transport. We were the only ones, so we kind of did whatever people wanted done, and we kind of pursued a Robin Hood approach. We charged the banks and the development organizations heavily, and then were able to heavily subsidize transport for people who were ill to the hospital. things like that. So
Wonderful.
on a good day, it was the best job I ever had, but
I
all
can
the
imagine.
days weren't good.
Yes, I bet. Well, if there are any questions, we'll be happy to take them. Yes, ma'am. Please stand up, state your name, and speak directly into the mic.
Hi, I'm Cynthia Butler. I'm an attorney in town and just interested in all these kinds of issues. I'm curious, how would you answer somebody that said, okay, you've got SNAP, you've got CHIP, and you've got a 14% hunger rate. What percent of that is children? I don't know exactly, but I mean that's an astounding figure. That's sort of the population of Canada, right? And so if you've got these programs, how is it that there is so much? Is it that the programs, even if used to the maximum for each person that's allowed to go to the maximum, that it would never meet their nutritional needs for the family? Or is it that these people are falling through the cracks and not getting in these programs? Or is it these programs are deficient within themselves? Or what, if you were going to change it, correct it, what's your fix?
Thank you.
Very good questions. And the answer is probably, to some extent, all of the above, but perhaps for different households in different situations. It would be scary to think of what our level of food insecurity might be if we didn't have those programs there. But even households that are getting those programs, well, it's not so surprising that they would still be food insecure because the benefits are probably not large enough to really make you fully food secure. And you might consider that you're having trouble even if you're having to rely on those programs. But the fact that very low food security is also fairly prevalent among households getting, say, a full allotment of SNAP or especially a half allotment, so they're relying on some of their own income, suggests that the programs are certainly not completely alleviating the problem. Now, some of the factors involved, SNAP benefits are based on average national food prices. But if you live in an area where food prices are 10 or 15% above the national average, well, to start with, even the underlying kind of basis for the allotment, for the SNAP allotment, it's a pretty, it's calculated to be adequate to meet your nutritional needs, but it's a pretty just barely enough kind of allotment. And then if you're in an area where food costs are high, it could well be inadequate. And then it's also based on the assumption that if you have some income in the household, you can use up to a third of it for food, so your SNAP allotment is reduced by that amount. But if you have unusual household needs, like you have a disabled child that requires additional money and cost, or one of the adults in the household has a chronic illness that requires additional cost, or you might live in an area that has high housing costs, there's a number of reasons why what is adequate at a national average level might not be adequate for some particular households.
Yes, ma'am. You have a question?
Yes, I do. Thank you. I'm Beth Gannon, and actually I'm a former teacher, and I did work with underprivileged children while I was teaching. My question of yours, your research is, after the questions have been answered by these households, what is the follow-up for the people who do fall into the at risk of having no food? What does the department do, and what do you do?
Thank you.
That's a good question, but we kind of have to back off a little bit and remember the context in which these questions are asked. If you're in this survey, you've been assured that your answers will be completely confidential, that the Census Bureau will not release this information to anyone for any purpose that can be identified to a specific household. So in the context of this specific survey, which is a sample survey, it's like 45,000 households or 50,000 households, so about 1,000 in each state. In that context, there is no follow-up for that household. Now, they can go apply for any of the food assistance programs, but there's no follow-up directly from the survey. Now, in other contexts, for example, when this module has been implemented at, it's been used in a number of food pantries around the country, for example, to get a read on their clientele. And they will often give a $10 gift card or something like that that people can use to buy food as a kind of an incentive to participate in a recognition of need. Most of the interviewing in the current population survey is done by phone, although about a third of it's done in person. But in the National Health and Nutrition Examination Survey, where it is all done in person, and it's a health survey, and there's a lot more kind of intense interaction, the interviewers actually kind of complained about that. They said this is the hardest module to sit and listen to a mother tell you that their children have been hungry and they haven't had enough food, and then to finish the survey and say, well, thank you for your participation, and walk out the door. So there's it can be painful, but in the context of a survey that's supposed to be anonymous and impersonal, you're kind of caught between the two. I'd be interested in your observations from working with underprivileged children in terms of the food programs like the school meals and WIC and so on. What were you hearing from them?
May I sit? Social workers have to become involved because parents may actually be in the illiterate category, so they do not know the means in which they can actually go to those resources or have people. They need people to guide them. They really do need hand-holding. And where I last taught, which was in rural Virginia, we had many kids that we had to explain either because their parents weren't doing anything, they were possibly unemployed, but the children were actually begging in the lunchroom for money, and the people behind the lines that were serving lunch would just give that to them because the families just weren't following up on what type of resources are actually out there. And this is in public school, and I have to tell you, it broke my heart every day. I would bring food in just so my kids could eat something in my classroom, and I was doing middle school. So I think one of the issues that has always touched me so much is what is the follow-up, but also I think people are embarrassed about their situation, and we've had to deliver food to families, and they're embarrassed. So I think a lot of people don't go out for those resources if they do fall into that category because of so many other factors, but I think embarrassment is one of them.
Thank you.
Dr. Nord, do you have a state-by-state statistics, say nearby states, Virginia, Maryland, West Virginia, how they fare?
I have them, but I don't have them in my head. We publish Table 7 in the annual report. Has a state-by-state breakdown. We have to put together 3 years of data, so it's not extremely current because to get large enough sample size to kind of have reliable statistics, you need more than a few households.
Historically, how?
But the highest, I know a few of the statistics. The highest rates of food insecurity in the most recent report were in Mississippi, and the lowest was in North Dakota, which is my home state, but I didn't rig the statistics. The highest rates of very low food security were Mississippi and might have been Maine. Maine is a surprising one.
It's very surprising to me. Maine. I see.
But anyway, they're all in the report if you want. But Virginia and Maryland are both relatively well off in terms of food security at a national standard.
So these states work hand in hand with the federal government, right, in recognizing which sections of their populations are greatly affected.
Yeah, and the food programs, although USDA funds them, they're actually administered at the state level. So it's very much a collaboration.
So allocations are at the local levels, state and then local levels.
Right.
Just to make sure that food
SNAP and school lunch are both entitlements. So that's anyone who qualifies gets them. There's no allocating them around. And WIC, in recent years, has been fully funded, so it's essentially available to everyone who qualifies as well.
Do generations of the same families suffer from the same malnourishment cycles?
Even within the same current household, long-term persistent food insecurity is very rare. We now have a couple of surveys where we've got longitudinal data for the same households for 4 or 5 years. And the percentage that will be food insecure in like all 5 years of a 5-year survey is almost vanishingly small. It tends to be a year or two, and then they kind of get on their feet again. It's more prominent in younger families and younger people. The transition from education to work seems to be a rough one. As you get older, you get more food secure. The elderly are the most food secure group in the country.
Of course, that makes sense. Any other questions? Well, I think, yes, sir, go ahead.
My name is Amin. I've worked as a therapist and also with poverty clients over the years. When you go into a grocery store and someone is using food stamps, it's a very good exercise to watch what they buy. Okay, very often white bread, Wonder Bread, bologna, Sunny's Delight, everything has high fructose corn syrup, which is where the weight comes from. So you can have you can have an adequate number of calories, but because they are the wrong calories, you can put on an incredible amount of weight or have diabetic problems. I'm wondering if we are able to think outside of the box. Now, I look at Brazil, and I've heard some wonderful things that they've done there, but of course, it means to break out of the capitalistic model by which things are provided. Now, of course, that's walking into the temple of the sacred in America to even suggest such a blasphemy. But what they've done in Brazil is they've had markets for local produce where they've been subsidized so people could buy things that were healthy at an adequate price. But more than that, they've had community restaurants where people, for a very small amount of money, picture the amount that it takes to go into McDonald's. When you're very poor, you don't get the big drink and the large thing. You get the dollar menu and maybe 1 or 2 things and maybe a soda. But what would it be like if there was a way to go in to a subsidized restaurant and be able to purchase an adequate meal for that same amount of money, which would have the right calories, the right diets, and it would just also, because there is a charge, even if it's a minor charge, there's some dignity with that. My concern in just giving additional food stamps, if you cannot buy the correct foods and if you don't really have the knowledge of those foods, then it's like the health pattern just keeps repeating itself. The detriments to emotional and mental well-being, which I think are getting fairly documented without adequate food, keep repeating themselves. And we never quite dig out of it. And I'm just wondering if there's been any creative outside-the-box thinking at the end. I do appreciate the fact that there is aid being given.
Thank you, Zami.
Thank you. You've raised enough things to talk about for a whole seminar, I think. But let me back up and give some research evidence on a couple of things first, because there is this perception that somehow food stamp users buy less healthy diets. The research evidence actually is that their both food intake and food purchasing patterns are almost indistinguishable from the general public. So this comes back again to what I said earlier, which is our diets as a whole in the country aren't so good. So you're probably right if you've stood behind someone using food stamps, which you can hardly tell now because they're all on electronic benefit cards anyway. But if you stand behind anybody else, you see them buying the same things. Now, having said that, however, the question has certainly been very much raised in recent years as to whether there aren't some ways in which SNAP could be proactive, or food stamps could be proactive towards promoting better diets. There's a packet of research up on that actually at our website. It's called Could Food Stamps Do Better at Improving Nutrition or something like that. And one of the pilots that's actually going on now, which I guess is a little outside the box, is called the Fruit and Vegetable Pilot. And it will actually give in addition to the whatever's on your normal SNAP allotment, vouchers that can only be used to buy fresh fruits. And I think both fresh and canned, maybe, fruits and vegetables, but trying to promote consumption of fruits and vegetables. There's also a relatively small program, although it's a few $1 million, called the I suppose it's now called SNAP education. It used to be called Food Stamp Education Program. That is essentially a nutrition education program. It's open to everybody, but it's people who are newly come into SNAP program are particularly encouraged to join it. It's not available everywhere, and the evidence of whether it really helps or not is also a little out there. One other piece is that there's recent evidence from the American Time Use Survey that households that get food stamps or SNAP on average spend more time in food preparation than households that don't. So in one sense, they appear to be buying more basic, less processed foods. But some of your other ideas sound, quite exciting, and maybe we can find ways to get to them. It's a lot easier to document problems than it is to come up with programs that actually get at the root of the problem without causing worse problems.
Dr. Nord, in your opinion, this isn't meant to be a political question, but have U.S. presidents used their bully pulpits adequately to address all these problems that we've talked about? And do you know what Mr. Obama has in store?
Well, I'm certainly not going to comment on the adequacy of American presidents at addressing food security. I will definitely get myself in trouble. But it's on record. The current administration, when it was still a campaign, said they would end childhood hunger. And since taking office, I know from statements both from the White House and from the Secretary of Agriculture and from our Undersecretary that they're sticking to that commitment in the sense of they're still saying it. They haven't backed off from it and said, well, maybe we won't be able to do that. Although I think it's going to be it's not an easy thing to do. 1.3% doesn't sound like much, but getting rid of the tip, you probably can't get rid of the tip of the iceberg without doing something about the iceberg as a whole. But there does seem to be, from statements that have been made, objectives that have been set, there seems to be a commitment to do something about, especially among children, food insecurity among children.
Well, thank you, Dr. Nord, very much for that enlightening talk. I appreciate you coming here. Hope you will come back again. Thank you, ladies and gentlemen.
Thank you.
Thank you. Appreciate that.